Welcome to section 10 of genetics. In this section, we'll be discussing autosomal trisomy disorders. Let's get started. This is a table of the autosomal trisomy disorders which can be found in section 10 of genetics. There are three that you need to be familiar with for step 1, and they include Patau syndrome, Edwards syndrome, and Down syndrome. Trisomy just means that there's an extra chromosome, which usually occurs as a result of maternal meiotic non-disjunction. So for example, trisomy 13 means there are 3 copies of chromosome 13 instead of 2. Trisomy 18 means there are 3 copies of chromosome 18. And trisomy 21 means there are 3 copies of chromosome 21. Okay, now let's discuss some findings seen in these disorders. At first, these may seem overwhelming, but I've organized the information in a way that will hopefully be straightforward and more memorable. Notice that I've shown in red the similarities between all 3 conditions. So all 3 conditions cause intellectual disability and congenital heart disease. In blue, you can see the similarities between Patau syndrome and Edwards syndrome. So they both have rocker bottom feet. Rocker bottom feet refer to feet that are abnormally shaped, kind of like a rocking chair. So if a foot normally has an arch like this, then a rocker bottom foot would look something like this. So normal has an arch, abnormal looks kind of like a rocking chair. Memorizing the information we've talked about so far will usually not help you get any questions right because these findings don't distinguish between the disorders. So in my opinion, I wouldn't waste your time memorizing this information. Okay, notice that the first several findings listed after the colored text are facial deformities. For example, cleft lip and palate, microcephaly, microphthalmia, micronanthia, and prominent epicanthal folds. These findings all sound pretty similar to one another and can be hard to remember, but after the facial findings in the table, there are several unique findings that are in bold and more memorable. For example, other findings of Patau syndrome include polydactyly, polycystic kidney disease, cutis aplasia, which is a punched out round lesion of the scalp with an overlying thin membrane, omphalocele, and holoprosencephaly. In Edwards syndrome, unique and memorable findings include low-set ears, clenched fists, and overlapping fingers. In Down syndrome, these include small ears, increased skin at the nape of the neck, a gap between the first and second toes, a single palmar crease, Brushfield spots, Hirschsprung disease, duodenal atresia, an increased risk of early onset Alzheimer's disease, and an increased risk of ALL and AML. You should know that there is an increased risk of Alzheimer's disease because chromosome 21 codes for amyloid precursor protein, or APP. APP is associated with the pathological findings found in the brain of patients with Alzheimer's disease. Anyway, my point is this. In test questions, you're usually given a handful of findings, such as a cardiac murmur, a facial deformity, and then you're almost always given 1 or 2 other findings that are unique to the disorder. Therefore, I find it most high yield to only focus on memorizing the bold text shown in the table because these are the unique features of the disorders that will ultimately help you distinguish the 3 disorders from one another. Definitely be familiar with the other findings generally, but your time memorizing information should mostly be spent on the bold text. Okay, let me show you some images so you can see what these look like. This is a figure of microphthalmia, which can be found in section 10 of genetics. Notice that this eye appears much smaller than the other one. This is a figure of microcephaly. Notice that the top image shows a baby with a typical head size, and the bottom shows a baby with microcephaly. This is a figure of a cleft lip. It's quite obvious, but you can see the cleft lip right here. This is a figure of holoprosencephaly. Holoprosencephaly is caused by failure of the brain to divide into 2 separate hemispheres and is usually associated with severe facial defects. Most cases are lethal. This is a figure of polydactyly. Notice that this is an X-ray of the hand and that this patient has 6 fingers. This is a figure of an omphalocele. Notice that the abdominal contents are outside of the abdominal wall and are surrounded by peritoneum. This is a figure of typical facial features seen in Down syndrome. You can see that the face looks somewhat flat and not as rounded as a normal baby. An epicanthal fold is the skin fold of the upper eyelid, which covers the inner corner of the eye. You can see that right here. These are typically more prominent in individuals with Down syndrome. The palpebral fissures are the openings between the upper and lower eyelids. In normal individuals, the medial canthus right here and the lateral canthus right here are typically on a similar plane. However, in individuals with Down syndrome, the palpebral fissures are upslanting. So if we draw an arrow through it, we can see that this is a little bit at an angle. This is a figure of small ears. Pretty straightforward, but notice that this child has small ears. This fact is actually pretty high yield because in test questions, small ears are usually describing Down syndrome, whereas low-set ears are usually describing Edwards syndrome. This is a figure of Brushfield spots. Brush-filled spots are white spots on the iris, which you can see right here. Okay, moving along, both Patau syndrome and Edwards syndrome usually result in death before the age of 1, whereas individuals with Down syndrome will usually live to adulthood. For Down syndrome, you should also know that a first trimester ultrasound may show a hypoplastic nasal bone and increased nuchal translucency. You should also know that 1% of cases are caused by a post-fertilization mitotic error, such as mosaicism, which we talked about in a separate video. 4% are caused by an unbalanced Robertsonian translocation, and 95% are due to non-disjunction, which has an increased risk with advanced maternal age. Okay, let's take a moment to discuss Robertsonian translocations because we haven't talked about this idea yet. This is a figure of a Robertsonian translocation which can be found in section 10 of genetics. This type of translocation occurs between two acrocentric non-homologous chromosomes. An acrocentric chromosome is a chromosome that has a centromere located near the end of the chromosome. In other words, these chromosomes have a long arm and a really short arm. You can see in the image that both chromosome 14 and chromosome 21 are acrocentric chromosomes because they have a long arm and a really short arm. So the cell shown at the top is normal, but the next cell shown right here represents a balanced translocation. Notice that the long arm of chromosome 14 and the long arm of chromosome 21 have fused together into one giant chromosome, which you can see right here. The short arms of these chromosomes have also fused together into one very small chromosome, which you can see right here. This small chromosome usually contains non-essential genetic information and is lost after several divisions. If the translocation is balanced, then the patient is unaffected because she will only have lost some non-essential genetic information. However, when an ovum with a balanced translocation divides into mature gametes, there will be many possible genetic combinations, which I've shown right here. Once fertilization occurs, the zygote has a small chance of being normal, but a much higher chance of having an abnormal genetic combination. Notice that only 1 out of 6 possibilities is normal. The zygote may end up with a balanced translocation, just like the mother, which means the child will be a carrier. Alternatively, the child can have trisomy 21 or several other lethal combinations. Monosomy 21, trisomy 14, and monosomy 14 are all lethal, so the mother will likely have many miscarriages as well. So in summary, most cases of trisomy 21 are caused by maternal non-disjunction, but a small percentage of cases will be caused by Robertsonian translocations. Okay, one final point before we review. This is a table of serum markers associated with autosomal trisomies, which can be helpful in diagnosing these disorders during pregnancy. This table can be found in the reproduction physiology chapter. We cover this along with some useful mnemonics in the pregnancy video, so I'm not going to cover them again, but you have them here for your review. Okay, let's do a question. A healthy 26-year-old female delivers a male at term. In the delivery room, he is examined and found to have flat facies, a gap between the first and second toes, and a cardiac murmur. What karyotype is most consistent with this patient's condition? A, 47XXY, B, 47XY plus 13, C, 47XY plus 18, D, 46XY with a translocation of chromosomes 11 and 14, or E, 46XY with a translocation of chromosomes 14 and 21. Notice that this question has 3 findings that should clue you in on the diagnosis. Flat facies, a gap between the first and second toes, and a cardiac murmur. The murmur is nonspecific and the facial abnormality can be difficult to remember, but the gap between the first and second toes is unique to Down syndrome and hopefully easier to remember. From the possible choices, it may appear that Down syndrome is not a possibility, but if you look closely, you can see that a Robertsonian translocation between chromosomes 14 and 21 could cause Down syndrome. Therefore, the answer is E. A is Klinefelter syndrome, which we'll talk about in another video. B and C are Patau and Edwards syndrome, and D is a translocation seen in mantle cell lymphoma. From the table, notice that flat facies and a gap between the first and second toes are unique features of trisomy 21. From this figure, notice that a balanced translocation can result in a gamete with 2 segments of chromosome 21. If this gamete becomes fertilized, it results in trisomy 21. Okay, let's do another question. A healthy 34-year-old female delivers a male at term. In the delivery room, he is examined and found to have microcephaly, a cardiac murmur, and a loop of bowel covered by a membranous sac that protrudes from the epigastric region. An autosomal trisomy disorder is suspected. What is the most likely diagnosis? Hopefully from the question stem, you notice that this patient has microcephaly, a cardiac murmur, and a loop of bowel covered by a membranous sac. This is describing an omphalocele. Again, the cardiac murmur and facial features can be pretty nonspecific and hard to remember, but the omphalocele is specific for Patau syndrome. Therefore, the most likely diagnosis is Patau syndrome. From the table, notice that an omphalocele is typically associated with Patau syndrome.